7 seconds to save lives. How leading pedestrian intervals reduce intersection accidents. Imagine a simple change that could drastically cut down on pedestrian accidents at busy intersections. According to a groundbreaking study, giving pedestrians just 7 seconds to start crossing before cars get the green light can significantly reduce injuries and even save lives. This innovative approach, known as Leading Pedestrian Intervals (LPI), has been shown to have a profound impact, particularly in New York City. Researchers from Columbia University Mailman School of Public Health reported a 33% drop in pedestrian-related injuries at crosswalks where LPI was implemented. The study, published in the journal Nature Cities, revealed that the most significant reduction, 65%, was seen in fatal pedestrian crashes during daylight hours. The goal of LPI is to provide pedestrians with a head start, allowing them to reach the middle of the intersection where they are more visible to drivers, explained Christopher Morrison, an assistant professor of epidemiology at Columbia University and the study's lead author. This is crucial because many pedestrian vehicle collisions occur close to the curb, where drivers often have a harder time seeing people crossing. New York City began rolling out LPIs in 2013 as part of the U.S. Vision Zero initiative, a comprehensive plan aimed at eliminating traffic fatalities and severe injuries. Alongside LPIs, other cost-effective measures promoted by Vision Zero include speed humps and rubber speed bumps. To evaluate the effectiveness of LPIs, the research team analyzed data from over 6,000 intersections in New York City between 2013 and 2018. Nearly 2,900 of these intersections had the pedestrian head start feature. During this period, there were more than 340,500 crashes, resulting in approximately 25,600 injuries and 291 deaths. Notably, 20% of fatal and 18% of non-fatal pedestrian crashes occurred at intersections with LPIs. LPIs are one of the most cost-effective and scalable traffic safety interventions available, Morrison emphasized. A mere 7-second delay for drivers can mean the difference between life and death for pedestrians. The study's findings strongly suggest that LPIs should be adopted more widely. As Morrison concluded, our research shows that LPIs work, and cities should consider implementing them to enhance pedestrian safety. For more information on the U.S. Vision Zero initiative and its impact on traffic safety, visit the U.S. Centers for Disease Control and Prevention's website. But here's where it gets controversial. Some critics argue that LPIs might cause delays and frustration for drivers, potentially leading to increased congestion. What do you think? Should cities prioritize pedestrian safety over driver convenience? Share your thoughts in the comments below. How leading pedestrian intervals cut NYC pedestrian injuries by 33%. What if a simple 7-second pause could save countless lives on city streets? A groundbreaking Columbia University study reveals intersections with leading pedestrian intervals, LPIs, in New York City saw pedestrian injuries plummet by a staggering 33%, a finding that could revolutionize urban safety globally. But here's where it gets controversial. This life-saving delay for drivers comes at the cost of mere seconds, forcing us to ask, is our commute convenience worth human lives? Diving deeper, these LPIs give walkers a critical 7 to 11-second head start before vehicles get green lights, allowing pedestrians to reach the center of intersections where drivers can actually see them. Most crashes happen near curbs where pedestrians are virtually invisible to turning drivers, explains lead researcher Christopher Morrison, Ph.D. of Columbia Mailman School. The data, drawn from 6,003 NYC intersections, the largest analysis ever conducted on LPIs, shows consistent safety improvements across all crossing types. Most shockingly, daytime fatal crashes dropped 65% where LPIs were implemented. New York's proactive adoption of LPIs forms part of Vision Zero, a data-driven strategy to eliminate traffic deaths through affordable tools like speed bumps and these head start signals. Considering the horrifying global toll, 1.35 million annual traffic deaths worldwide, 68,000 U.S. pedestrian fatalities 2011 to 2020, such scalable solutions feel urgent. Yet critics might argue, do these delays worsen traffic congestion? Can cities afford widespread implementation? Morrison counters powerfully. That 7-second driver delay isn't an inconvenience. It's the literal gap between life and death for pedestrians. The research methodology deserves attention too. Using precise NYC Vision Zero data from 2013 to 2018, scientists mapped injuries within 100 feet of intersections. Among 2,869 LPI-treated crossings, the pattern was undeniable. Pedestrians gained visibility, drivers gained reaction time. Co-author Sadesh Zaidi, a city-dwelling researcher, emphasizes the real-world impact. As someone navigating these streets daily, seeing NICDOT's interventions actually work is profoundly reassuring. And this is the part most people miss. LPIs represent one of the most budget-friendly safety tools available. No expensive infrastructure, just smarter signal timing. With identical results across diverse intersections, the study in Nature Cities makes an irrefutable case for global adoption. So we pose the question openly: should every city prioritize pedestrian seconds over driver seconds? Where would you implement LPIs first? Debate your viewpoint below. We're eager to hear where you stand on this life-or-death traffic trade-off.